All right, so I want to welcome everybody to the Live Well Kalkaska Substance Free Coalition, Coffee with the Coalition. This is just an informal conversation to talk about substance use disorder, mental health issues in and around our community. And today we have Kate Dahlstrom. Is that how you pronounce your last name? Dahlstrom? Okay, so we have Kate Dahlstrom to talk about a community crisis wellness center for children and adults going in Grand Traverse County. First of all, I want everybody to introduce yourself and what you do for the community. Sarah?
Good morning. My name is Sarah. I'm with Up North Prevention Catholic Human Services. I am out of Otsego County. As far as what we do for the community, I'm still fighting into this spot and getting to know it, but obviously working to prevent substance abuse. We'll leave it at that. Sorry, I'm not a good public talker.
Oh, that's fine. That's fine. Yeah, I'm still learning myself. So, so Linda?
Okay. Thank you so much, Suzanne. I love this Coffee with Coalition. I have watched a few of these already, so I'm excited to be a part of it. I also am with Up North Prevention as a prevention specialist for the Traverse City area, and I'll be looking at ways to engage with the community and educate the community a little bit more at large, make new connections, network a little bit more to kind of see what place everybody has as we try to make our community a safer community. I kind of bring to the table background with sex traffic victims. And so that's something that'll probably be part of my picture. I'm hoping to do a training for key community leaders and all of us here in the coalition, anybody with interest, to learn a little bit more about what that looks like and how we can start to make an influence and make a difference with the people that we are interacting with, and especially the at-risk population. So
yeah, we'd like to have you come and talk on Coffee with the Coalition.
Thank you.
Yes. So Tracy?
Well, good morning or afternoonish. How's everybody today? I just kind of popped on late, a little bit late. My name is Tracy, and I am a prevention specialist also for the Grand Traverse County. I'm also a peer recovery coach with Families Against Narcotics, as well as soon to be facilitator for Stronger Together for the statewide group. I'm looking forward to being able to educate and gain some more knowledge from everybody. It's been wonderful just learning what everybody is doing and what they have to offer. So thank you.
Thanks. Megan?
Good morning. Here, I'll turn my camera back on. I'm working from home today, so it's a little crazy. The cat's all over me. My roommate's cat, she's gone. So I'm Megan Sorensen. I'm from District Health Department number 10. I'm a public health educator in Wexford County, Missaukee County, Crawford County, and Kalkaska County.
All right. Thanks, Megan. Susie Klein.
Hi, that's my grandson. I explained earlier, I'm on my phone. I'm not very good at this. So anyway, I'm Susie Klein. I'm the lead angel for the Michigan State Police Angel Program in Grand Traverse County. I'm also on the board of the Grand Traverse Drug Free Coalition. I also work with Kate and Nancy on this wellness center. And that's about it.
All right, thank you. So, like I said, Kate Dahlstrom is going to be talking about this new community crisis wellness center that they're talking about building and putting into movement here, and we need it. And so she is a parent advocate with NAMI, and she's on before, during, and after incarceration. Are you on the board or just a part of it?
Yes, I'm on the board of NAMI and BDAI before, during, and after incarceration.
Yeah, I used to go to their meetings. Anyway, so you can take it away.
Well, thank you, Suzanne, and thank you for having us. The more we get connected, the better we are going to be able to serve our region. And I'm going to say region and not just Grand Traverse area, because the Wellness Center will be, for now, a regional facility until other parts of northern Michigan are able to do similar centers or smaller centers. So just to give you a little history, we had third level crisis center, back in 2018 and years before that. And that was serving people to the extent that it could, with the limited funding that it had, people in crisis, and doing assessments and trying to, get people situated in the most appropriate place possible, which are very limited, as you all know. And so that was then outsourced to Protocol. And we just, through NAMI, myself as a parent advocate, saw that we needed better crisis services. And that's, the funding is here now. And the state, Michigan Department of Health and Human Services, has recognized that. And they have adopted, and they're still also working on fine-tuning certification of a CSU, that's Crisis Stabilization Unit, and Crisis Residential Unit. Those operate under some of the adult foster care rules, and for children, there's separate rules for them. So what we recognized that there was this huge need, and many of us, because of our own family experiences, and we started working with Northern Lakes Community Mental Health and pushing as much as we could to get something done. And so they did in 2021 applied for almost $5 million SAMHSA grant to do a crisis stabilization unit, which would have mainly served adults. There was very, very limited service for children. It would basically be pretty much what children get at the emergency department. And I'm not sure how much you work, you have children, you probably, with SUD experiences, do you have many of those situations with children that need placement and are in crisis? Anyone here? Not so much. It's mainly adults. Well, anyway, there's a lot of kids that are going to the emergency department. Record Eagle's been covering this issue quite well. Some of these kids are staying for a week or more. I think there was, in the northeastern part of the state, a young man under 18 who stayed for almost a month in the emergency department because there was no place to put him to help him. So we didn't really wanted kids included, but they weren't going to be. But anyway, we just said, okay, we'll take what we can get. The SAMHSA grant didn't go through. It was not awarded to Northern Lakes Community Mental Health. That happened approximately August or September. But about the same time, the Northern Michigan Shire is CHIR, which stands for Community Health Innovation Region. They've been around, and maybe, let's see, Megan, you may be aware of them because they kind of cover the Northern Michigan County Health Departments. It's kind of an interesting entity, the way it operates. But in any case, they did a Behavioral Health Action Summit November 4th. I don't know, is anyone here at that? Because there were 150 participants throughout mainly Northwest Michigan. And out of that arose 12 teams to focus on different needs for Northwest, especially Michigan. And ours was the crisis center because the community mental health had just been unable, had just failed at getting this big grant. So that was kind of appeared to be dead in the water. And so there were a number of us that were interested in working at it on this from that under the umbrella, excuse me, of the Shire. So anyway, we, the group that came together, we have co-leaders, and Nancy's one of the co-leaders. Excuse me, Sarah Hubble from Leelanau County, Terry LaCroix Kelty, who's the director of behavioral health at Munson here in Traverse City, and myself. And then we have about 13 different group members representing BDAI, Ryan Hannon, Goodwill Inn, Stacy Kaminsky from Community Mental Health. We have Child and Family Services represented, Pine Rest, ATS with Chris Heimbaugh, and some others from Munson and CMH. So we are actually having a meeting this Thursday. We meet monthly, but we do most of the work in between the meetings. And at this point, it's been mainly the leaders. Hey, there's Nancy. Hello. That have been involved. So what we have right now is a building that we are having the lawyers look at to see if it will comply with the zoning. And it's part of a condominium complex in Traverse City. So they have to see if that's, if we can use that building. And we also have, and I've given that abstract to Susanna. Maybe she could forward it to the rest of you if you're interested. Some guidelines. We're working on a business plan, which business kind of operations plan for the center, so we can take it to the county commissioners, Grand Traverse County in particular, to ask for SAMHSA money, or excuse me, ARPA money for the center. Grand Traverse County has 18.2 million in ARPA funds to use. So we're going to probably ask for 2 or 3 million for the center. So we have that in the works. And so how it will operate is it would probably be the hub for mobile crisis services. And it will have this crisis stabilization unit, which will, folks can walk in. It would have separate sides for youth and adults. People can walk in, the police can bring someone in. The EMS could bring someone in as long as it wasn't a true emergency. And then their assessment would occur, and the stabilization or de-escalation would start immediately. And the crisis stabilization units, as they're designed in Michigan, are for up to a 3-day stay. Mm-hmm. And during that time, a safety plan will be put in place. NAMI, we hope NAMI, we know NAMI would be there to immediately embrace the families and natural supports, because that's also a big gap, right? We don't see families and natural supports being part of the recovery plan nearly as much as they should be. So, we'd like to work on that from the get-go. And if someone is not stabilized or de-escalated within the 3 days, then we have the crisis residential unit, the CRU, would tentatively be in the back of the building, children and adults separated by concrete walls, or not concrete, but walls according to what the state's going to require. And those stays are up to 14 days with possible renewal for another 14 days. So that in part of that would be, we've got a number of people that are very interested in doing things like, different types of holistic therapy, art therapy, dance, music, animal, nature, all kinds of things that need to be more fully utilized in someone's recovery path. And so your focus is, as I understand it, is mostly addiction services, right? SUD and those kinds of services. We don't know exactly how that's going to look, but we want to, work with ATS it's most likely that if someone needs detox, they will be assessed and taken to either ATS or Munson's acute detox. And there may be a room or two rooms though for folks who just need to sober up and then get mental health services. That's not been worked out. But so in a nutshell, that's what we hope to accomplish. But I want to leave time for Nancy, or maybe questions in between, and then give Nancy an opportunity to talk about, how she's been in this from the start, and her experiences and more.
So I can bore all you guys to death. Do you want me to go?
Yeah, you can give us a little bit of your background just for
Sure. Sure. Hi, I'm sorry I joined late, everybody. So I'm Nancy Stevenson. I worked at Northern Lakes Community Mental Health. I was the crisis director or crisis wellness director beginning last June, but I worked there for the last 6 years. I was a home-based therapist for the severely emotionally impaired children, along with IDD children who had that emotional impairment as well. And then moved on to access utilization management, and then promoted into becoming an ops manager for that department, and then was offered the job for the crisis wellness director. And that's kind of where I landed and how I became involved with Kate and just amazing people. So what that entailed was I noticed right away that there was some gaps in service delivery for crisis services, partly because the mobile piece was lacking. And I would say a lot of that has to do with, we're considered rural, and so many of the policies and how the protocol on what is on service delivery and how that's going to be mitigated is usually based out of metropolitan areas, and very little, I've always had a problem with that. Like, it just seems like folks who live in rural regions or the UP, it doesn't seem like that has been factored into decision making, like what that's going to entail. Transportation issues are always a barrier at some capacity with some of the families being serviced or individuals being served. But that mobile piece is lacking, and which that ends up being a trickle down effect from law enforcement. Well, first and foremost, the person being served, being handled and when they're in crisis, responding to police officers who are coming in a uniform, tends to escalate the crisis rather than de-escalate. Even if the police officer's intention is to do just that, their presence can be kind of intimidating. So it heightens rather than de-escalates.
Hey, Nancy, can I ask a quick question while you're talking about mobile crisis services? Mm-hmm. So Kalkaska is in North Country CMH. Mm-hmm. And do you know, or the ladies here know, if North Country is providing actual mobile crisis services to folks in a crisis?
I don't know. I don't know the answer to that.
Go ahead.
Yeah, no, I think like the crisis screens that were being done, at least at Northern Lakes, were usually done once the person was already in jail or in the hospital. And usually those are typically adults, but kids too. Northern Lakes then implemented the FAST team, where a crisis worker would go to the school. Mainly schools were utilizing that service, but they would show up at parents' house if they called and needed a clinician's presence there. So I do know that the FAST mobile services do have clinicians going out in the community. We just need to have that with adults and have it be real time. So that it can be doable, and then we can start seeing the benefits of that. So law enforcement, Grand Traverse County, and I and one of the clinicians that I had hired, we went down to Washtenaw County because they have a pretty great model in crisis response, mobile crisis response team that was actually implemented because of law enforcement. They needed to see a change, and they wanted to they both entities recognized the pros and benefits of partnering would be and what that could possibly look like. So they did that. They started to partner and formed and worked with NAMI to see like how they could really improve that service. And boy, did they ever do it. Like, it was just so cool going down and looking at their treatment facility. They coined it as an outpatient treatment facility, which really eliminated several of the barriers that come in place once you have a crisis residential unit. For licensing purposes, they're not technically a crisis residential unit, but they do have that outpatient piece where that person can de-escalate for 23 and a half hours. But that entails a clinician and a police officer. They handle it as a team. So police go in to make sure it's safe, take care of the safety barriers if there are any. And clinicians are there, right there on site, right there on the scene, so that person can get assessed or de-escalation can start at point of contact with a clinician. And then they have an amazing cares team for aftercare, which is another component that I feel, would greatly benefit this community region, Kalkaska too. I think mental illness has gone as being stigmatized. It's not like, somebody said it great. Like, if you have heart surgery, you have people calling you within a day of you being discharged to follow up to see if you're experiencing anything that needs to be looked at, just to follow up with you. That's an area that I think we can all improve on, just to touch base, see what's going well, what isn't, and then problem solve what's not going well. I think that, I don't know what it's like in Kalkaska County, although I can take a stab at it, that, the region's being underserved. I think rural areas in general are being underserved, not out of need, not out of greed per se, but I think that the staff shortage really is a barrier to providing good, thorough care to anyone. If you're not adequately staffed and you're constantly dumping more work on your workers, like, something's going to get missed. And we're in a crisis. Everywhere is. I bet MDHHS, I know in Grand Traverse County, they have a significant shortage. And so they end up borrowing state workers from other counties to help, lighten the load, which compromises care. It does. And so I would say that even if Grand Traverse County is experiencing this significant of a staff shortage crisis, I'm going to call it a crisis because it is, I would imagine Kalkaska is probably even in worse shape. Am I right?
Yeah, and well, in the hospitals, we're having issues in hospitals, I think. One of our issues is the opioid epidemic has turned into meth.
Yeah. Yep.
We have so many people that have this issue with the meth, and they go into the emergency rooms and they're clearly in psychosis and not making sense. But yet they don't see them as having any health issues. So they're released out on the streets, and that's dangerous. It's dangerous for the community. It's dangerous for them. And I've had this, a personal experience with it. And
sure.
Or they're on opioids and they're still, they've been Narcan, but they're still not coherent. But they're, as long as they're stabilized and there's no physical danger, they let them out on the streets, even though they can barely walk. Yeah. And there's a lot of that going on. I mean, there's a lot of stories.
There are. It's heartbreaking.
One of the ways, and they. Go ahead.
but one of the ways that we, for the Wellness Center, how we're trying to address this shortage of clinicians is by involving all the agencies that are, providing services already and using telehealth as much as we can, and telepsychiatry. We're going to have a separate group that explores that possibility. And with Pine Rest having as many clinicians as they do outpatient, and Munson has a number, it's possible that one or two of these psychiatrists, psychologists maybe could meet with their regular consumers or patients at the center. And then if they're already there meeting with their regular patients, then, they would be available when a crisis came in, or they would be available to do rounds a couple of times a day, or whatever the requirement is. So we know we need to be very creative on how we utilize the staff that we have until we have more staff.
Mm-hmm. One of the suggestions I've had in helping with the staffing crisis too is if there's any way at all for entities or agencies to contract with local universities or just universities in general for paid internships, and maybe implement contingency plans, because if that's the area of interest of a social worker working with somebody with addiction, or substance abuse issues, we're in such dire need. There's no reason why we can't start taking a look at that to help everybody out. That's a win-win for everyone, because if you do maybe a contingency plan, even for a year, that's potentially a year you don't have to worry about filling a spot with a body and training it, training that body. If they're doing their internship there, they're getting on the job training and it's paid. And if it rolls into like a potential employment opportunity, I think it's all the better for all of us. So looking at those ways to strategize, what do we already have in place that we can make better? You're muted, Kate.
I am. Thank you. Does Catholic Human Services have a mobile crisis vehicle? Do you go out into the community at all there?
I don't think there's anything on the west side, but I think I believe there's something on the east side when it comes to like overdose and stuff going back.
Because ATS has, a couple of those vehicles.
They have three.
I
think there's three. And I don't know that last I knew they were not being used.
Right. And they were willing to share. They may share one of theirs with us, the center, and have it be, because it would be a hub, we hope, for mobile crisis services. Mobile crisis services have been done in some areas like Oregon with that Cahoots service for 20 years. And a lot of times it's not a police officer and a clinician. It can be a clinician and a peer. It can be a clinician and EMS. But in any case, if a police officer is involved, we hope it will be a plainclothes police officer. So it's not someone who's going to alarm the
in
person
an unmarked car.
Yeah.
In an unmarked car also.
Right.
Yep.
And it's shown that they can, first of course, they'll be people in crisis will probably call 988, which is, MyCal. For Northern Michigan, those 988 calls will go to MyCal. If they can't de-escalate there, then the next step is mobile crisis services, where people go out into the vehicle. I mean, some people can do a walk-in, but it's usually more effective to meet people where they are because they're not willing to walk in or whatever the situation. And it's been shown that mobile crisis teams can de-escalate 60 or 70% of the calls that they make.
Right.
And if that doesn't work, then you have the crisis stabilization unit, where people actually then are staying and in Michigan, it can be up to 3 days. Now, Washtenaw County opted to do almost 24 hours rather than 3 days, but we're looking at doing 3 days.
They did that because of licensing regulations, and they felt like they needed to start serving people right now.
Mm.
Who knows? They may build up to that, but like getting something in place right now seemed to be more like what they wanted to do, just to get that change rolling. I just think like if we're able to divert whenever appropriate, you really significantly reduce that chance or opportunity once that person or that individual or that child is in the hospital already or in jail. You can't divert somebody who's already been picked up. I mean, you just can't. So it's just something to think about. As far as substance abuse too, like I know that in Traverse City, we started seeing that trend too, where the drug of choice was initially heroin, and then it changed to becoming meth. So like I empathize with Kalkaska County if that's what you're seeing now. I would imagine that your emergency rooms are just as bad as ours are with substance abuse and mental health issues versus like the physical traumas and, you know, physical health issues. If that's the case, I'm sorry.
I mean, I don't understand why the two are separated at all, because substance use disorder is a disorder of the brain, and it should be considered, you know, a mental health issue.
Agree.
When you have someone in the hospital because they're on a substance like meth, and they tell you that, well, it's a drug problem, that's a mental health issue.
Right.
You question that. And then you also have that, you know, most of the time, typically with someone with substance use disorder, they have a co-occurring mental health issue.
Sure.
So
yep,
I would agree.
So what's the problem?
Yeah.
You know, and it's, I guess they can't dig down to figure out what it is. So they just keep self-medicating until it's like they can't get the care that they need, the mental health care that they need.
Right. And the problem too that runs into like with it being when there's a substance abuse, known substance abuse history, such as alcoholism. Where social workers can run into problems, alcohol it's a deadly detox, right? So that's a medical issue that needs to get looked at first as a priority.
Right.
I think personally, when it comes to detoxing, Michigan is sorely under-resourced to effectively handle that and give good care. We have 2 facilities in northern Michigan, 2. And if you take the total number of beds, I would probably bet that maybe, and I might be shooting high, 30 beds.
So is Munson and
you can fill those in a day.
Is Munson and Traverse City the only Munson or only hospital that does acute detox?
Yes.
Munson, Kalkaska doesn't.
I don't think so.
There's nothing in Kalkaska.
Nope.
But I know Munson acute. Terry said one time I asked her about beds. There really isn't a limit because they use regular hospital beds.
Mm-hmm.
I don't know if that makes sense. ATS, of course, for the subacute has, you know, limited beds, but
yep.
Yeah.
And then Bear River is a facility that you can use too. And I think that they also do detox, but I also seems like I recall not too long ago that facility is no longer an option to use anymore. Is that correct or no?
I think I heard that as well. I don't know if they started it back.
When did
anybody else know
when did that occur?
So again, please verify that. But I seem like I recall hearing that probably back in December sometime. There was a huge, significant staffing shortage, I think.
I heard that as well.
I know they're not taking anybody right now, but I know that they were here recently.
Okay.
because I know they were full and that because I was just getting a client to
Okay.
get in there.
Was
and
that for
she's on a wait
detox?
list.
Was that for
For-
detox or was that for treatment? Okay,
Detox.
it was detox. Okay. Yeah, and then Harbor Hall used to have a detox facility and they closed that one down.
Did they close that one down because of the COVID though? I mean, because
No,
Was
they
that-
had to have, I think they had to have a nurse present 24/7 or something like that.
Yeah.
They didn't have that.
Yeah. Yeah.
but I know we don't have enough here in
We
northern
don't.
Michigan and the surrounding counties as far as detox and residential. And now with Phoenix having closed their doors to, the 30-day treatment and that, I was just like,
I know.
oh, now what? Because
Now what?
that was the
Yeah.
only thing in Traverse City. So go ahead.
It looks like Bear River is maybe back up and restaffed. I'm on their website. So
Okay.
Munson Hospital. Now, we have Terry and a couple other people on our team, and they're really committed to this wellness center. But Munson as a whole, I think personally could be doing more. And I think emergency rooms in every hospital ought to have some kind of crisis service, a combined, a mental health, behavioral health, let's just say crisis service. I mean, to try to de-escalate and it doesn't make sense to me other than it's money. I think it's a bottom line issue, but I think, it's reasonable to demand more from Munson.
or at least training. Their staff needs a severe amount of training as far as how they are treating people that are coming in from overdoses or, like mental health crisis. I mean, a lot of them, very seldom have I ever heard anybody go in there and say they were very helpful and they were, they treated me with dignity.
Right.
I've never heard that.
That's an excellent point because a lot of times training, there's a CIT training and other de-escalation trainings. And I'm sure you guys have all kinds of, help for assisting people that are, needing addiction treatment services. And yes, training is across the board an issue, right, Nancy?
So yeah, it is. But I will tell you, part of the reason why that is because there's such a huge staffing shortage that
Yeah, I was going to say that.
Oftentimes training gets put on the back burner just so that they can get a body going and start taking cases without having the training in place to handle the it's a tough job. All the jobs that everybody on this call has a tough job, right? And if you don't have the adequate CIT training or the de-escalation training, you're not going to be able to implement that skill set. You're just going to do what you think is right at the time, right? Which is why I think it's really crucial that we get those interns trained because they're going to have more time to do the training that makes those CIT skill set and de-escalation skill set and motivational interviewing skill set. They can actually go to the training, learn from the training, have it be part of their curriculum.
Right.
Right.
As we come out of COVID though, emergency rooms should be, give them some time to take a breath or two, of course, but they're going to have more time. And, this week, actually Thursday, Ryan Hannon from Goodwill is doing a CIT training, a trainer training type of thing, or I don't know if it's CIT, but it's related to that, the crisis services. So you don't really benefit in the long run if you don't take that 8 hours or whatever it is to do the training. You've got to look at the long picture. And I totally agree. We see people just last week at the emergency department with a mental health crisis of some friends at NAMI. And the interfacing with these poor people, the parent, the supports, and the person in crisis could
and
be
the workers. And the workers. I mean, obviously nobody wants to go to work to like judge anybody, but if you feel like you're so short staffed that you can't do your job, you're going to be shorter, snippier. You're not going to be your best self. And and I'm not trying to minimize anybody's feelings on this call, but I can also tell you, as somebody who used to do, the home-based therapy, seemed like when there was a full moon, all of my kids were in crisis. So by the first crisis I was handling, I was on the ball and Johnny on the spot. But by the time I got to the end of my day, I was not my best self. I just wasn't, So I think that we're up against staff shortages, employee burnout because of staff shortages, lack of training, lack of internal support. I mean, there's a lot of these barriers in place, but I do
too much
think
paperwork,
administrative overload. I think I do think that this pandemic has shown a light on on all those warts, as I like to call it. And hopefully, the powers that be are way more open to suggestions on how to do more effective, efficient, quality care with less administrative burden. I apologize, I got to get off, but thanks for inviting me.
Yeah, thanks for joining us.
Hi, Nancy.
Yeah. Have a good day, guys.
Thank you for your time.
Thank
Very
you.
informative.
Thank you. Have a great day. Bye.
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 Yeah.
Okay, where you're trying to get the wellness center up and running, is that correct?
Correct. And we're trying to get funding. So once we get this business plan, and we're going to work with Health Management Associates in Michigan, we have a grant to pay for their fees. And so our team will work with them to do kind of an operations business plan with more detail than the abstract that we gave to Suzanne. And so we're going to request money from Grand Traverse County for the building. We're going to the state. We've been in conversations with our state reps like John Roth and other state reps, Mary Whiteford, who's doesn't represent us, but she's a huge advocate for improving behavioral health and SUD services for Michigan. She came up to our area. She was on a listening tour to hear what our needs were. And we've been in touch with her for, almost a year. And so the state they tell us that there's going to be some significant dollars coming to Northern Michigan. And so we've been in constant communication with them. We're looking to our county for funding. Once we get an established fiduciary, and we're very close to that, then we will probably go after private donations as well. And we may, go to neighboring counties once we, get some of our first monies coming in and say, hey, if you want to be part of this and possibly even on the board of this wellness center, because we're looking to have the area agencies involved to be board members. And the state has told us so far that there's no reason we can't do that. And we need to get Medicaid reimbursement. However, we would need to contract with CMH to probably provide the crisis stabilization unit services. And that's not a problem. And we're working with our CMH anyway. So there's a lot going on, and things are really moving along, not nearly as fast as we would like, of course, but we're really excited. It's going to happen. The Shire, has a lot of clout with the state, and then they're the kind of the parent to this whole movement or project. And so, we're trying to make as many people in the community aware of this and to speak to their county commissioners and ask that they get behind this, that they use some of their ARPA money to support this, to fund it. And So, even letters to the editor or emails to the county. We're just trying to get the awareness out there. And yeah, so we're having our meeting Thursday. We meet monthly, as I said, and I will forward the invitation to Suzanne if it's at 3 p.m. And Nancy, and the 4 co-leaders that I told you about will mainly be giving updates on where we are with some of these different aspects. But
would I be able to attend, or is that strictly?
Sure.
Okay.
Yeah.
I would be interested also.
Yeah. So Suzanne, if you'll forward, I'll just send it to you, and if you'll forward that.
Yep, I'll send it with the abstract.
Yeah, and I'll send you also that possible organizational chart that we've looked at. Again, we had the state look at it, and that's the Department of Health and Human Services to say that would work. We just have to, for Medicaid reimbursement, CMH has to be in there. But we have Munson's backing because of Terry LaCroix-Kelty. And we will go to Munson also and ask for money once we have that operations plan in place. So,
Kate, do you want to tell them where the building is?
Well, so the building, and don't say anything because until we have this.
Okay, then never mind.
Yeah, because we're on Facebook Live.
But it's close. Let me say this. It's close to Munson in Traverse City, and it's close to Pine Rest, which, right, if we're going to ask some of their staff, their clinicians to come over and help with services. So yeah, it's a good location, and we're just keeping our fingers crossed and saying our prayers that the review goes well.
Yeah.
And I love the fact that you're implementing like the holistic healthcare portion of it too, because I'm very much about the holistic aspect. I got NADA certified, which is the detox for ear acupuncture. And then being a Reiki master doing energy healing. So that's like super cool.
Oh,
I'd love to have,
wow.
yeah.
We need you, Tracy. You can volunteer. So we're going to ask for people. We'll show the different subgroups or whatever that we want people to volunteer for. And,
absolutely.
Yeah,
absolutely. I love it.
And it doesn't mean that's going to be your second job. It means we're going to lay a framework for what we want to see happen, and then either hire people or get volunteers. And each volunteer, we're going to ask them to do an 8-hour, CIT or some kind of training related that we feel would be necessary to be in the center and helping.
Absolutely.
Yeah. And I love
help me in.
Animal therapy. So did you know Florence Nightingale was one of the first medical people that jumped on board with animal therapy?
Really?
Yeah. She apparently had a little owl that she would put in the pocket of her smock and yeah.
Oh, wow.
But I just think, we want to have somehow, a dog or dogs. Guinea pigs are really good therapy. Horses, there's a lot going on with the equine therapy. So, and just, once get folks connected and then keep them connected when they leave, the wellness center, these CSUs, the design is comfort and a welcoming atmosphere. If you look at what's being done around the country, the decor and everything is very comfortable. And for someone who would stay 3 days, what they use are these like reclining chairs that actually almost make a bed. So, because that's a question people will go, well, how, if you're not actually having a bed, because the beds would be in the crisis residential unit part. But I think if we knew someone, from day 1 or 2 needed more care, then we'd probably try to move them into a bed rather than keep them in one of these chairs. But the whole idea behind these units is comfort and a welcoming feeling. Each one would have a little kitchenette kind of thing, and not sterile. Like, yeah.
Well, I'm excited about it. So
good. We are. There's a lot of excitement. We so need it.
Well, it would give a place for, like I said, we have a lot of people who are using meth and they're out, walking around or driving around and not in the right mind. They're in psychosis or, just not functioning, and there's no place to put them, unless they have drugs on them. The police don't do anything.
Right.
The hospitals don't take them. They don't like to put them in detox because they say that there really is no physical detox when it comes to meth. So there's no place to put them, and they're just out there, with no place to go.
Right.
A lot of them are, like I said, they're in psychosis, which is a mental health crisis.
It is. And so we
No
really
matter
need,
what it's caused from.
yeah, we really need you guys involved because we don't have anyone giving us input on how we incorporate services for those kind of folks. Yeah. We just had ATS tell us that, if they need detox, they can come to here or go to Munson. But for those who aren't needing that, we need to help, we need your help developing how you maybe separate rooms and what the services would be.
Right. Correct me if I'm wrong, Tracy. But they do, the only way they'll take someone on meth and detox if they're using opioids or alcohol as well. Otherwise, they don't feel that there's a health risk.
I mean, for detox?
Yeah, for meth. They don't actually detox for meth. So they'd have to put,
but they're not.
Because the only thing that they go through is of course they have a lack of sleep, and they don't eat. So when they're coming, down off of the meth, they're extremely hungry, and they sleep for quite a while. Actually, they sleep first, and then they wake up eating everything.
Mm-hmm.
Now, is that fairly new, Suzanne? Like, because I thought, like, with the ATS's detox, I know it's been a little over a year, 2 years maybe, but I thought they would take people to detox off of meth.
No, only if they're on another substance that needs to be detoxed, like opioids or alcohol. I know this from personal experience. If a person wants to go into detox when they're on meth, they have to say that they're on an opioid or alcohol.
All right. Well, that is good to know. Thank you.
Yeah, we've run into that. So.
Yeah, your input will be extremely valuable in the planning for this, because we really, want to accept everyone pretty, for the most part. There is a medical screen that many of these, I don't know if the state, I imagine the state is requiring it, that they would first go to be sure that they really shouldn't be, go to like the emergency room to be seen for a medical issue. And we have, some examples that actually the one came from Santa Barbara, the medical screen that they use. But Common Ground down in Oakland County is doing a lot of this and they have it for adults and children. They have the residential, the crisis stabilization residential. We're working pretty closely with Common Ground, and we've, done some Zoom meetings and that to learn. We don't want to reinvent the wheel, but so we want to see what's working, try to use those things. But, if we need to tweak it and innovate it a little bit, fine, but we're not going to start from scratch because other places have been doing these things, some of them for years. Yeah.
Yeah. I was part of starting a safe house up here in Grand Traverse County. Well, this area. Not in this county. The house wasn't in this county. But a lot of the things that you're talking about as far as procedures, intake, a lot of them could be because of the drug overdose or the different things, but they also can come from an abusive situation, or it can be kind of a legal thing. And so they don't really belong in jail, but they need a safe haven or a place to go. So I would love to help in any way I can in helping what your policies and procedures and the things that you're conversing about right now and setting that up.
Well, thank you. That we welcome everyone, because you guys see in the needs that many of us don't, and you have that unique perspective. So it's so invaluable.
And another reason for healthcare for someone that's on meth is when they start to come off of it, they experience extreme depression and are at higher risk for suicide. And a lot of times like I said, they don't get a whole lot of treatment unless they are able to get into, a facility, an inpatient facility.
I talked to
there again, that would be prevention. That would truly be prevention, to be able to intercede at that point so it doesn't escalate to that level of suicide.
Yeah. I talked to Captain Clark at the Grand Traverse County Sheriff's Department, or I sent him an email a while back to ask him how many mental health crises calls they made in the 3 months that ended December 31st. And they made 72 behavioral health crisis calls and 63 attempted suicides in a 3-month period for Grand Traverse County. Yeah. And you know what? Southern Michigan is doing a lot more. There's so many more of these kinds of initiatives going on in Southern Michigan. And part of the problem is, as you guys know, grants. A lot of this stuff is grants. And if you don't do the hard work of writing the grants, and a lot of that falls on the CMHs, but again, their time, is tight. But if you don't do the hard work of writing, asking for some of these huge grants that are out there right now, especially the federal grants under SAMHSA. There's some great grants for mobile crisis and crisis stabilization, and state grants too, that, and a lot of the smaller CMHs, they don't have grant writers and things that downstate has. So I think, I wish they would recognize that and take some of this out of the grants and just make it a funding source without having to jump through all the grant hoops.
Well, does anybody else have any more questions? I think we're pretty close to time here. Yeah, it's 12:06. We're a little after, but that's fine. We started a little late. No questions?
Well, it's been a good conversation, and I'm so excited to have you guys.
Thank you.
And
Thank you so much.
I'll connect you with somebody through, from Catholic Human Services, Kate. So I'll send you an email address that you can connect, and I'll let her know that I did that. So.
Okay, great. Well, thank you very much.
Yeah, absolutely.
Thank you.
We appreciate you coming on.
Very nice connecting with you.